Earlier this week, Baystate Health reported its lowest number of COVID-19 patients in the ICU since the pandemic began. While that number inched up again slightly today, doctors say the overall trend is a positive sign, at least for now. Tonight, we take a look at the coronavirus numbers from the largest medical center in Western Mass, where they've been and where they stand now. Since mid-March, Baystate Health has sent out a daily report on the number of COVID-19 patients in the hospital and those in the ICU. Earlier this week, the ICU number dropped to its lowest at just 2.
This is likely the product of the interventions we have adopted both from the state and locally in Western Mass, from social distancing.
Here's a look at the numbers from the Baystate Health system since March 16th. The blue line is hospitalizations, which you can see peaked April 9th at 179 and stood as low as 21 June 3rd. The red line represents those in the ICU. That number peaked April 3rd at 41. This chart clearly shows the downward trend continues. Baystate Medical Center infectious disease specialist Dr. Armando Baez says there are at least 2 reasons.
Those patients who are vulnerable to those complications have already been infected and got admitted and already passed through that, and we don't have any more of that population, not enough, or have been prevented from being infected because of the measures we have taken.
Dr. Baez also says doctors are learning more and more about COVID-19 and how to treat patients and to better prevent the need for putting them on ventilators.
There are certain measures that we have adopted in the hospital to prevent intubation requiring ICU care.
Those measures include something as simple as flipping a patient over, called proning.
But that means we ask the patient to prone, which means to lie on the stomach. And that allows oxygenation, or better oxygenation of the patient.
The number of patients in the ICU and those hospitalized has crept up slightly in the last 48 hours or so. Dr. Baez says they are keeping a close watch on any surge, particularly as the state begins to reopen.
It may not be as big surge, if ever, compared to the initial one. Number one, because we know better now than before. We know how it's transmitted and how we know more now than before in terms of managing those patients.
As we've heard so often, Dr. Baez says that the key to another surge or preventing one will include keeping up with social distancing. And for more coverage on the coronavirus pandemic as it develops, log on to our free Western Mass News streaming app.